Hi there, my name is Dr. Lay at Lay Dental Care in Elk Grove. Today we're going to go over the difference in crowns that you can get at a dental office. So there are many options out there. Of course, there's all gold crowns. Unfortunately, gold nowadays are very expensive, so that can be a little costly for you. There's an all metal crown. That's a blend of metal. Of course, aesthetically, it's not the most pleasing appearance. And the typical ones are called PFM, porcelain fused to metal. Here's an example of that. There's porcelain on the outside and metal on the inside. And over the years, the connection between the porcelain and the metal will get weaker, and they will chip off, and then you get these chipping of the porcelain off the metal. If you see people out there with these type of crowns, you can look at the gum line. There's a dark shadow around their gum line. That's a typical PFM appearance. So nowadays, last 10 years or so, they've come out with better products such as Emax. Emax is an all porcelain crown. So if you look from the inside here, no metal involved at all. If you shine a light through it, it has a lot of translucency. So if you have a natural tooth and you put a crown over it, the light goes right through the tooth, right through the crown, hits the tooth and reflects back and gives a very natural looking appearance. So that's the more aesthetic one. It's called Emax. And of course the last one is called Zirconia. Zirconia is made usually for posterior teeth because it has less abrasive characteristics. So there's zirconia called Bruxer. That's for people who brush their teeth, who grind their teeth. So these are excellent for posterior teeth for people who are grinders. So all different type of crowns. Longevity wise, Bruxers are probably the best one for posteriors. Emax are the best for anteriors. PFM, those are older type of crowns. The difference between the Emax and PFM is Emax are bonded to your teeth. What does that mean compared to a PFM, which is cemented to your teeth? When you cement PFM, it will over time the cement will dry out and there will be micro leakage. Bacteria can travel in there, can cause you recurrent decay around the crown. Then you lose the crown and you have to end up maybe root canal or redo the crown. With an Emax, the crown is actually bonded to the tooth like a filling. So the connection between the crown and the tooth no longer is there. It's filled in with a resin type of bonding agent. So that seals the crown up a lot better than a typical cemented crown, PFM crown. So this will prevent cavity long-term wise. Aesthetically looks a lot better. If you take an x-ray, you can actually see through it, so you can actually diagnose if there's recurrent decay or not. A typical PFM, when we take an x-ray, we can't really see through it, and so there's cavities under there. It's very difficult for us to diagnose, and then we have to wait for the patient to tell us if there's symptoms or not. If there's symptoms, then we have to remove the crown and look under, and most of the time it will end up being a root canal and then a new crown placed on there. Information on different type of crowns. If you have any questions, feel free to give us a call.